Yoga therapist customizes the yoga journey according to my needs or anything.
A transition to a new life and a new journey that you want to start. Asana will help you manage, but I will not say that it will completely reduce the belly fat. Because it is a constant practice that you have to keep doing. I think this journey is not the end of the best years of your life. It's just the beginning and the new phase of your life.
The most underrated part of yoga is
breath. I'm feeling very overwhelmed, so I would take some restorative poses and then begin my journey, how my body feels.
Thank you, Shilpa. Thanks for your time again and sitting with us and understand yoga a bit more detailedly. So in the previous episode or conversation, we discussed about yoga, basic asanas and flexibility, everything. And we also understood one thing, like there's a difference between yoga as a therapy and yoga as a trainer. So what does yoga trainer do and what does yoga therapist do? I mean, what is the difference basically?
So the yoga trainer teaches yoga and it is moreover for a general health purpose. Anyone can just go in for a yoga classes. But when it comes to a therapy or you're looking forward for a therapist, like a yoga therapist, then it is more confined to your specific need. So we use the theoretical tools and create an approach based on your specific needs. For example, a person is coming to me with hernia. So there would be a lot of contradictory poses and he or she can just not enter a general yoga class, would have to take a help of a therapist so that the therapist knows, okay, these are the contradictory poses that we should not be working out with a hernia client. Also, we need to check in their reports at what stage is their hernia. Are they operated or are they doing it post the hernia surgery or are they coming in prior to the hernia and at what stage? So there are a lot of criteria that we look in forward. The same way, simplest thing is people with BP. It looks like, people with high blood pressure, low blood pressure, just go and walk into a normal general yoga class and start practicing. A lot of strength based training and too much exerting yoga asanas, which are not recommended. Also, there are a lot of inversions which are not recommended for a BP client. So I think you have to choose wisely based on your specific need. If you have some health elements, please walk into a yoga therapist and also try taking an individualized class rather than just entering a group class or a beginner class.
So basically yoga therapist customizes the yoga journey according to my needs or anything. So for example, if I have to start yoga as a, just to be healthy or fit, I can go to group class. And if I have personal or something which I have to work on, either BP or hernia or menopausal issues, I should go to a therapist so that they will understand my needs and customize.
Because there are a lot of limitations also for a particular element, right? So you just cannot walk into a general class and just start doing things. It is like, I want to, increase my flexibility, so I'm going to a yoga class. It should not be like that. You need to understand your body. What is your body looking forward for? Like, you just cannot go enter a beginner's class if you have some or the other problems. And also it is a teamwork. We also work with the doctors as well. It's not because yoga is not a replacement to medical science or medical things. You have to work along with the doctors. It is not that you come to yoga and you stop taking your medications. No, sorry. Even for a smallest thing like thyroid, which is not considered as a disease, but you need to take your thyroid pills before you start with the yoga. And you continue along with it, and then you will see the change, and then might be you will reduce in the mg of thyroid tablet that you've been taking.
Dosage.
The dosage or the mg, whatever. So you have to reduce. Might be you're taking 150 mg, you will reduce it to a 75 mg. So that is how it is.
Got it. Shilpa, can you help us understand more about menopause and perimenopause and how can yoga help and which kind of asanas we can practice?
Perimenopause, it's a constant change that keeps happening to a woman's body. Today she's experiencing something, tomorrow she'll be experiencing something. For example, today I have a lot of stiffness in my body. tomorrow I'm feeling very fatigued, very low on energy, or for example, what you said is like hot flashes. So how can I deal with hot flashes when I'm going to a yoga class or towards a yoga therapist? So the yoga therapist would suggest that let's start with Viprita Karni to relax your nervous system, to calm you down. Or you can just sit, take some conscious breath. You can practice cooling pranayam like Shitali and Shitkari practices. That would really help you to manage your hot flashes. If nothing, you can just do a simple child's pose. You can just practice the child's pose. That also is very calming and relaxing during different phases of perimenopause, what you're going through. So for hot flashes, you can confine to pranayam. For lower energy, you can work on a child's pose. Too tired legs, you can work on Viprita Karni. Since in perimenopause, we are supposed to take care of our bone density, which most of us have been speaking about strength training. So there are a lot of beautiful standing asanas that can be practiced for strength. There are a lot of pelvic floor asanas and exercises that can be practiced during the perimenopause, like Baddha Konasana, also known as butterfly pose. Then you can work towards your hip flexor muscles to relax them into a low lunge, or also called as the Anjaneya asana. So there are different asanas that can be taken to help you manage the symptoms but not stop the menopause.
So basically we can only manage it to an extent and feel more relieved, and the journey will be easy.
Yes, because it's a constant change. And ladies, I want to tell you one thing. This is not the end of the best times. Menopause, premenopause phase, most of them are fighting against this. Please do not fight. It's a transition to a new life and a new journey that you're going to start.
Thank you, Shilpa. I mean, this will help a lot of them, to understand and start with practicing the asanas which you have told us. It will maybe easier, make the journey easier, I can say.
Yes, it would really make them easier, because what you feel for your body, you are fighting. When you move your body into gentle restorative poses or a gentle yoga practice that day, will surely change the mood, will surely enhance to understand her body better. Because everyone here is fighting against one thing, is mood swings, is what I get to hear. There are terrible mood swings and fluctuations that are happening just because there is a huge fluctuations in our hormones. The progesterone and the estrogens are raising up and down every day, and the cortisol hormone is rising up, because of which we also have a lot of cravings, and we all are worried with one thing called as a belly fat. I request ladies to just work on your body, listen to it, do not fight, do not complain. I think it is a time for you to start working and listening to your body, rather than just looking forward to only one thing, that is weight. So work on your nutrition, good sleep, good gentle practices, and work on your strength. That would be the takeaway, I would say.
And as you said, belly fat, that is the most thing every woman worries about. So will yoga help in reducing the belly fat, or do we have any particular asana which will help in that?
See, again here, there is nothing called as a spot reduction. And in this phase of perimenopause, it is a change. And that also change, your body will take over, and it's just a phase of life. You can work, being consistent on your mat, being consistent with your strength training, being consistently moving after your meal, sitting in Vajrasana will help you manage, but I will not say that, it will completely reduce the belly fat. Because it is a constant practice that you have to keep doing, and that would rather help, because there's no spot reduction, whether it's in your perimenopause or you're on the journey of reducing your belly fat.
And Shilpa, during this phase, people also have this lot of, they will have a lot of stress or anxiety or overthinking, mood swings or fluctuations. Would you suggest anything for that phase?
Simple way to manage stress and anxiety is consciously breathe. Move your spine and slow down.
So that will help.
Yes. So
Okay.
spine movement, if you ask me what is the best asana, I guess you can just do cat and cow, very, very simple. You can do it sitting also, just hold, even now you're sitting on the chair. So you
Okay.
can just depress your spine, lengthen your neck, and
Okay.
gently pull the belly button in and tuck your chin to your chest. A cat and cow. Sitting
Okay.
cat and cow, a
Mhm.
conscious breath. Breathe in and breathe out. And just slow down, child's pose.
Okay.
Yeah, that would be a great help. It's just a 5 minutes, 4 to 5 minutes of work that you have to do.
Mhm.
You don't have to rush all the time. You don't have to rush all the time. You can just slow down. That
Okay.
also will help you manage your stress and anxiety.
Okay. Shilpa, we have a rapid fire round.
Okay.
So do not think about too much. Whatever comes into the mind, just fill in the sentence.
Okay.
Okay. Yoga taught me.
To listen to my body.
Okay. The biggest mistake beginners make is.
Trying to be someone else, seeing the Instagram post or any yogi's perfect pose. To be in the perfect pose rather.
Okay. Women after 40 should pay more attention to.
Strength, better sleep, nutrition, and listen to their body more often rather than just thinking about weight gain.
Okay. So one thing I wish every woman knew about menopause is.
To start listening and think this journey is not the end of the best years of your life. It's just the beginning and the new phase of your
Okay.
life.
Okay. You don't need to be flexible to.
Do yoga.
Yeah. If your body says stop,
Please listen to it. It is asking you to please reduce the intensity. It is not complaining. Please understand when the body is saying to stop, please listen to it.
okay.
Yeah.
The most underrated part of yoga is
Breath.
one yoga practice I wish people did more often.
Working on restorative poses, very, very beneficial.
Okay. So, what are restorative poses?
They are just being in the present moment. Yeah, because we all the time rushing. So restorative poses will balance your nervous system.
Okay.
It makes you present in that moment. Like, you're not rushing. You're just staying in the pose for a while, breathing in, understanding, feeling the sensation of your own body.
Okay. Okay.
Yeah. So practicing restorative poses would be one which I request everyone. It is not all the time rushing or doing power yoga, intense workout, cardio, strength building. Yes, strength building is there, but restorative poses are very, very beneficial.
Okay. The biggest misconception about yoga therapy is?
It's only about very soft and gentle practice.
Okay. So it is not.
It is not. It is confined to the person to person who is coming in for you. There are a lot of movements, there are a lot of stretches in that. There's a lot of mobility. There are a lot of strength building asanas. Again, we do a combination of restorative poses. There are in practices. There can be hatha and vinyasa also in a therapy class. It is not confined that therapy class is very, very slow or very gentle or boring. No, it is not.
Okay. Okay. If you miss yoga for a week,
it's okay. Please come back again.
Okay. Yoga isn't about?
Just not touching your toes.
Okay.
Yeah. It's not about just touching your toes. It is about understanding your body, mind, and soul.
Okay. Got it. So now I have few more situations. Like I want you to tell us if you are in that situation, what would you do? Okay. Tell me what kind of yoga practice you would consider if you woke up stiff.
I would start moving my body gently, work with some good stretches because it is all about waking up the body, not rushing the body. I would start with a simple cat and cow and then gradually move into slow Surya Namaskars that will help me to wake myself.
Okay, so to release the stiffness.
To release the stiffness, yes.
Okay. You had a terrible night's sleep.
In that case, I would start again with gentle yoga. And I would work on slow, longer exhalations that would help me to calm my nervous system.
So that is breath work.
Yes, breath work.
Okay. If you're extremely stressed?
If I'm extremely stressed, I would go again for a gentle practice, more of restorative poses.
Okay.
That would help me to guide my body through.
Okay. If you have been sitting at desk for 8 hours,
please start moving, do some stretches, do some neck rotation, because when you sit for longer time, I feel it's the neck that gets stiff, then is your spine, and then the lower part of the body. So you can do some of the neck movements, you can do some of the shoulder movements, you can move your spine with cat and cow, and then use some hip flexor asanas to stretch the lower part of the body.
Okay. If you're low on energy,
I would check on myself. If I'm low on my energy, do I really require rest, or do I want to stimulate my body? So based on that, I will go ahead. If I feel that I can stimulate my body, I would start with an intense practice, more towards Hatha Yoga, Vinyasa practice.
Okay.
But if I feel that my energy is really low and my body is longing for rest, I would rather practice Yoga Nidra and have a good sleep.
That's nice. And if you want something calming before going to bed?
Calming before breath is all about being to yourself and getting prepared for that good sleep. So I would practice some gentle movements on the bed. If my body permits me, I would take a Viparita Karni, the legs up on the wall, some conscious breathing, a Yoga Nidra, and a Supta Baddha Konasana that will help me relax my lower part of the body or my tight hips after a long day.
Okay. If you want to become stronger, not just flexible,
then please do practice a lot of Hatha Yoga, Vinyasa practices. Because yoga is not only about flexibility, it also is about strength building. So based on what you want to achieve from your practice, so accordingly, choose your practice.
Okay. And if you're going through perimenopause and feeling overwhelmed, okay.
So I will start with gentle, because restorative poses are my special ones. I have learned a lot to stay in the present moment.
Okay.
Because it's just that mind that keeps moving you, you keep rushing. You are always thinking, what next, what next, what next.
Yes.
So to calm myself, I would take some conscious breath. I would start with some gentle movements. I'm feeling very overwhelmed, so I would take some restorative poses and then begin my journey, how my body feels.
Okay. Shilpa, can you name us few restorative poses?
Very good one is a simple Baddha Konasana. It can be a restorative pose, child's pose, then Viparita Karani.
Okay. And for example, when we are in this restorative pose, should we hold in that pose for a second count of 10 or 5?
Yes, that is all. The thing is to be there in the present moment, along with your breath, into the posture in an active mode, and feel what your body is going through. It's like observing that subtle sensation that your body feels.
Okay.
Are you feeling stiff? Because when you stay still and when you are breathing consciously, being mindful on your mat in that posture, that will help you to understand what your body is looking for or what your body is longing for. Yeah, based on that. So it is always good to stay in that posture. Yes, you have to be staying in the posture. Yes, at least for 5 breaths to 8 breaths, and then if you feel better, you can continue staying for 10 breaths, 15 breaths, or for a minute.
Oh, okay.
Yes.
Okay. Shilpa, what is one thing you would like all the listeners to, as a key takeaway, if something they have to start from tomorrow, or as a key takeaway, what would you say to them?
A key takeaway would be to begin or start with, you can practice with some simple basic asanas that are demonstrated here. Yoga is not about changing your body to fit a pose. It is about using the practice to come home to your body, understand it, and take care of it.